if you live in America and you are over 40, healthcare is a good enough reason to get the hell out of there. Now, I myself have left America about 3 years ago. I came here to Southeast Asia and I stayed here to live here permanently. Now, I have a confession to make. I originally came here as what they call it, a pass for bro. I came here for a better dating scene. Now, the grass turned out to be not that much greener or the other side. Definitely greener, but that's a whole different video. However, I stayed here for all other reasons, and healthcare is my top 3. So let's talk about this. Now, I'm almost 50 years old and I've always taken care of my health because health is essentially the most important thing you own. And not only health is what is going to dictate how long you're going to live, but it's going to dictate something more important, which is the quality of that, hopefully, long life. There are 5 problems with the healthcare in America, and pretty much every single one of you who lives there knows it. Number 1 is you absolutely have to have a health insurance. You can't just pay your way through doctors and hospitals and the healthcare system unless you're a multi-millionaire. Number 2, the health insurance itself is very expensive. You either have to have a pretty decent job, which most people don't have, or you're going to end up paying a lot of money that a lot of people cannot afford. Number 3, even if you do have a great health insurance, as you probably know, when you need to make an appointment, especially with a specialist, it doesn't matter how much money or how good your insurance is. You might end up waiting many days, sometimes a couple of weeks, even if it's an important appointment with your cardiologist or endocrinologist. There's just not enough doctors. Number 4, it's access to drugs. Not only a lot of drugs that we enjoy pretty much around the world, prescription drugs, are simply not available in America, but a lot of times they either get discontinued or there are shortages. So if you're relying, and a lot of people do rely on a specific drug or a lot of times multiple drugs for their lives sometimes, but at the very least for the quality of their lives, and they're out of stock or discontinued, your life turns upside down. And lastly, and this could be one of the most important things actually, American healthcare is really dependent on doctors catering to the insurance companies, especially with HMO plans, where essentially your insurance company that's trying to save money on you will tell the doctor how to cure or not cure your problems. So let's go over those 5 points and compare them, America versus right here, Southeast Asia. But before that, there's an honorable mention that I wanna bring up to your attention. And I'm talking about this because I just did a very extensive health check. And I mean extremely extensive. Every single part of my body was scanned, measured, a long list of all kinds of tests. I spent 8 hours in the hospital doing all these tests. Every single hole in my body, every single organ in my body has been examined, and I have a full report of 100% state of my health. Now, in America, not only a lot of people don't do health checks, a health check like this is not even available. Now, you can pay your way through it, but it will be thousands and thousands, if not tens of thousands of dollars. Right here, I just did this checkup and it cost me less than $500, which brings me to my number 1 point. Even though I don't recommend it, and unless you're extremely sick, you can pay cash and pay your way through most of your life here with the affordable prices that many hospitals have here. And we have some government hospitals where you will probably not receive the top of the line world healthcare, but it's still pretty good. For example, here in Thailand, our king and queen go to obviously a public hospital and they're pretty good. There are also different levels of private hospitals that are also excellent, topping off at the Bamrograd Hospital here. That's one of the best hospitals in the entire Southeast Asia. So you can pay as you go and not have health insurance and not go bankrupt. Number 2, the health insurance is actually very affordable here as well, just like almost everything else. One of many reasons why I enjoy living here. As a matter of fact, I'm not even 50 yet, and I can easily retire. I've known some people who retired into their 30s and 40s because of how affordable the life is here. And the health insurance is one of them. My health insurance is only about $350 a month, and I don't have any deductibles. I even forget the names of all that bullshit that I had to deal with in America. Deductibles and co-payments. I got none of it. I pay my health insurance and they cover pretty much everything 100%. 100%. I don't remember reaching for my wallet except for my insurance card ever at the hospital. And I go to the best hospital in Southeast Asia, and these doctors are world trained. Many of them have trained in America or Europe. These are top of the line doctors with top of the line equipment. As a matter of fact, hospitals here look like hotels, like luxury hotels. They even have the food court floors, most of them. It is an amazing experience. They have bell service, they have valet park. I mean, it really is a pleasant experience, you know, for the situation if you have to come to a hospital. But I do want to mention one thing. When you get here and you get your first health insurance, which I recommend to get literally even before you step your foot into your new country, there is no Obamacare here. So the pre-existing conditions is a thing. So when you come here, any pre-existing condition that you have to disclose. I mean, of course, how do you determine what a pre-existing condition is? Is it still existing? However, once you start seeing doctors here, they will very quickly identify for themselves what the pre-existing conditions are, and then those conditions will never ever be covered. So it's very, very important to get your health insurance right away and make sure to pick a provider that is unlikely to ever leave whichever country you're in. So that's one important nuance. Number three, and honestly, this alone could, I don't mean to be dramatic, but save your life. I'll give you an example. When I was in America, I thought I might be having some heart issues and I needed to see a cardiologist. Well, even with my excellent Blue Shield of California PPO insurance, there were no appointments. So I had to wait for 2 weeks. 2 weeks while I had concerns with my heart. And then once I see my doctor, he says, well, we have to do the stress test because, you know, I need to know what's going on. That took another 2 weeks to schedule the test and get the results. That is 4 weeks that a guy with pretty damn good, probably one of the best health insurances in California, had to do. 4 weeks. If this was, thank God, nothing. It turned out to be nothing. But if it was something, waiting on a heart issue to even be identified, 4 weeks, unacceptable. Funny story. When I got here, shortly after that, I had very similar sensations and feelings where I thought, I better go and check it out. Do you want to guess how long it took from me calling the hospital and not only seeing a doctor, but also getting the results of that same test that he ordered? 2 hours. 2 hours. I walked into the best hospital in Thailand and saw a specialist cardiologist within 1 hour. And then within an hour, they already done the test and had the results. That alone is worth getting the fuck out of America and coming here. Because again, thank God again, you know, false alarm. But if there's ever a problem and it is not a false alarm, timing is everything. Your money, your insurance, none of it is going to matter. Timing is everything. So by the way, this is not just one anecdote. This happens all the time. I always sometimes don't bother making appointments. I only do that if I want to see a specific doctor. And even then, a lot of times, if that doctor is on duty that day, I will be able to see that doctor. So the fact that there is no wait time here and the tests are done, you know, almost immediately with the best equipment, with really, really good doctors, that is just I was shocked. Now let's talk about drugs, kids. So obviously we have way more drugs that are available here because there are no like really stingy rules on what kind of drugs can make it into the country. There is not that much of a political fighting, and health insurance and drug companies don't have as much leverage. So a lot of these drugs are available everywhere. Now, of course, it's up to you to do your own research. Of course, you can go and check if this drug was banned or not allowed by FCC or European regulators and why. A lot of times it's timing. They take too much time to allow a good drug. And because the doctors are internationally educated, they will give you some information about, some of the risks of these drugs, or maybe some of the studies that have not been done that FCC requires. So the availability of these drugs is amazing. There are tons of companies, specifically from China, here in Thailand, and many other countries that are supplying Thailand with all different kinds of brands. I personally have never had a problem with, or heard anybody having a problem where the drug was unavailable. Now, I did have one of the drugs that I was taking, medications, discontinued. And immediately I had about 5 different other choices right away. Now, so just that alone. Now, a lot of these drugs, you don't even need to have a prescription. You don't need to have a prescription because, as you guys probably know, the stupid rules in America are quite stupid a lot of times. A lot of substances that you need to take on a regular basis are considered to be controlled substances. You cannot get a supply for more than 30 days, which usually is just one. And then if they run out and you show up at the pharmacy and they're like, we're out. And you're like, well, but my time is just run out. I can only get 30 days at a time. That has been a problem in America for the same drug that I just told you that had 5 different alternatives here without the prescription. Now, by the way, there's another way how you can handle this possible problem that I have never heard of here. You can take a 1-hour, $50 flight to one of the neighboring countries, Cambodia, Vietnam, Laos, Indonesia, whatever. They have their own pharmacies and their own hospitals that may have stuff that you need available right away. Some people do that, though, again, for a bit of a different reasons, but they just jump on a plane, buy whatever they need, come back the same day. Don't even need a hotel. So availability of drugs and the fact that the choices are just endless is another part. Now, number 5 is very easy. Essentially, these doctors don't give a fuck if you have insurance, if you don't have insurance. As a matter of fact, most people who do come to these good hospitals here don't have insurance, they pay cash. So, and my doctor has never asked me if I'm paying cash or insurance because he just doesn't give a fuck. None of them do. They will advise you on what you need to do regardless of what your insurance is. They kind of all assume that you're paying cash one way or another. So they take care of you the way your health should be taken care of. The fact that every doctor has an insurance company in America, some more, some less, right? HMO versus PPO, sitting and they're all grabbed them by their balls and pushing them down to make sure that they don't spend too much money in you. And therefore, a lot of times the doctors are either handcuffed or literally bribed by insurance companies that you are not going to win as a patient, because every time it's the insurance company that wins. Here, they're not part of the equation at all. They're part of the payment equation at the cashiers, but the doctors don't care about that at all. This is another huge, essentially advantage here in Southeast Asia and many other countries. So if you ever needed a reason why your life will be much, much better overseas, and I will outline many others on this channel, healthcare should really be on top of your list, because good healthcare that you can afford will make sure that you live long and enjoyable, for the lack of a better word, life. If you have any questions, let me know in the comment section. It could be anything from healthcare to anything else that you want to ask me, because I'm also going to try to answer the questions that are on a specific topic from the comment section and spin those off into separate videos on this channel.